I can have mental challenges that are causing me real physical problems. If you think about it, your mind doesn't know when it's going through something, whether it's real or not. You ever watch a video and look at a roller coaster? All of a sudden your heart starts beating really fast. Well, the same thing. If you have, concerns and stressors and worries, your mind is very aware of that. And very often it can demonstrate itself in physical imbalances.
We have Dr. Lois Greene with us here in the studio. Dr. Greene, how you doing?
Charisma, I am blessed. It is my honor to be in this studio with you today.
I'm telling you, I absolutely appreciate you. I want to, first of all, give the audience some insight into who you are and what you actually do. So let's just start there.
Okay.
Give us the bio. Give us all the information.
Well, let's see. So I'm actually a nurse by training. So I'm an emergency room nurse by training. I started my career in the emergency department. And that's where I really kind of developed a love for people and for wanting to empower them to be as healthy as possible.
Nice.
And you're absolutely right. The healthcare system is very, very challenging to navigate. But I really believe that God wants us to be healthy and wants us to, live our best lives. So I'm happy to be here to have this discussion. After I finished nursing school, I went on and I got a master's in business because healthcare is a business.
Yeah, come on.
And it is important that we understand that. And then I went on to get a doctorate in health administration. So right now I am the Senior Vice President for Wellness. I say wellness, equity, diversity, inclusion, belonging, experience, and population health at University Hospital in Newark, New Jersey, where it's my pleasure to kind of serve as the people executive. And I love that because there's a lot to do that we can enhance the lives of people. And I feel privileged to be able to do that.
Black girl magic all day. But I mean, it's awesome to kind of hear that you have a whole bunch of experience that probably I won't even be able to kind of delve into everything today, but I'm going to try.
I'll be back. Don't worry. We could talk another time.
Absolutely.
But we're going to cover the topic.
I'm telling you. So let me ask you this, because I know that you're in the healthcare field, and I'm going to give a personal story, which is going to kind of help, I think to kind of further the explanation of why I wanted to do this. But tell me a little bit, I know that you are a believer. Am I correct?
I absolutely am. Love the Lord. Absolutely.
Okay. So tell me, does that or has that influenced your decision to practice in medicine, or how does that impact how you do what you do?
I think that my love for Christ absolutely impacts why I'm in healthcare. I like to say that my mission is to minister to those in need of healing according to the gospel of Christ, and to foster the values of love, compassion, justice, and reverence for life. And it's my faith that allows me to care for people, because I think that's what Jesus did. Nice.
I mean, and that is absolutely awesome. And to have someone in the medical field who kind of understands, has that given you a little bit more like insight when you're dealing with the patients and clients?
Absolutely, because I don't like to be a patient, and I don't like someone else to be in control of my life. So I understand when patients don't get the medical field. It's we have a lot of jargon. We have a lot of, rules, and it's really challenging when all you want to do is get back to living your life.
Right.
And you may be interacting with the medical field and not understanding why things are the way they are. Right. So I feel like I'm everybody's sort of personal nurse. I love to make sure people understand what they're doing, and that it's about jointly. It's not just what the medical professional wants. It's really encompassing what you want as an individual with what the medical profession can help us get to.
Nice. Now, let me ask you this, because you said something that's very key, because we are supposed to get what you said, what we want, right? And sometimes I think that there is a huge disparity in getting that or translating that. And I know that you probably would know a lot about this, but as far as like being a Black woman in the healthcare system, one of the biggest topics right now is African American women and childbirth.
Yep.
So have you seen, I know this might be a bit of a weighted question, but when it comes to the care provided to African American women, do you see that there's a difference? Or
you know what? They've done studies, right, that have shown that regardless of the color of the provider, that there are disparities in how different individuals are treated. So they've given scripts to actors and said, I'm going to give the exact same script to a Caucasian male, to a Black male, to a Caucasian female, and to a Black female. And who do you think gets the best care?
Wow.
Who do you think?
I think probably the white female.
Nope, the Caucasian male.
Oh.
All right. Who do you think gets second best care?
That's a good question. I know it's not the Black person. It's not the Black female or male, is it?
Which one do you think?
You got me on the wire. I don't know. Tell me.
Take your best guess.
Is it the Black male?
It is the Black male.
Okay.
Exactly. And who gets third?
Maybe the Hispanic male.
We're only dealing with the four. So the Caucasian female or the Black female?
Probably the Caucasian female.
Correct. And then the Black female last.
It's last.
Yeah. And so when you're looking, and there's a lot of information out there, anybody can look at maternal health statistics and see that the outcomes for even an educated Black female can be worse than their Caucasian counterparts. And so there's a lot of factors that have to do with that. But what I'm here to say is that we can make a difference, right? So healthcare institution can do their part by making sure that they do evidence-based medicine, right? So that there's the right protocols. And then women can make sure that we advocate for ourselves, right? So if you are, you've delivered within the last year, that you communicate that when you have a problem and you might have to interact with the healthcare system after you've had a baby, because they count maternal child incidents within a year of delivering. So if you begin to have blood clots or you begin to have high blood pressure, all of these things can impact how the mother does, whether it's before the pregnancy or during and after.
Wow.
Right? So it's really important that if we have chronic health issues, women especially, that we manage them. Oftentimes women are the ones who take care of other people, but we're not taking care of ourselves.
Right.
Right? So it's important that we both do our checkups, right? And not just while we're in childbearing age, right? I had a woman one time and she told me, I make sure I go to my gynecologist. And I went to him when I had my son. I was like, well, okay, how old is your son? She's like 30. And I'm like, you know what? We need to see our GYN doctor every year, every couple of years. We need to make sure that we take care of ourselves and that we do things to prevent illness, right? God says that he would want us to be in good health, right? And he wants us to prosper even as our soul prospers. So what does that mean, right? What does that mean? There's a lot of, we just came through a pandemic. People are on 10.
Yeah, you're right about that. No, you're right about that.
10. And so, we need to look at how are we looking at our physical health? How are we looking at our mental health? Going through a pandemic is very scary, right? And people don't realize, that impacted me. How did it impact you? What are you thinking about? Are you having anxiety? Are you not interacting with people? So there's a lot to think about.
And it's good that you brought that up. With the disparities in healthcare, and you also brought up another point. And I want to ask you this before I even get to that, because we know that mental health is a big deal.
Huge.
Right? It's a very big deal, and we know that physical health in and of itself has an impact on mental health and vice versa. It's not something that we can isolate or, separate one from another. So my question is this: when it comes down to, how people are given care within the healthcare system, is it a strong push to incorporate mental health, or is it just primarily the physical health that we focus on?
The challenge with healthcare is that your MDs are trained in physical health, and you have clinicians that are psychiatrists or clinical psychologists or therapists that are trained in mental health, and they don't often talk to each other, right? It's a really astute primary care physician that can kind of work you up and realize, I can't find anything physical. Let me refer you to someone who may be able to evaluate if something's going on emotionally. very often, even individuals don't accept that. They don't recognize that I can have mental challenges that are causing me real physical problems. If you think about it, your mind doesn't know when it's going through something, whether it's real or not. You ever watch a video and look at a roller coaster? All of a sudden your heart starts beating really fast. Well, the same thing. If you have, concerns and stressors and worries, your mind is very aware of that. And very often it can demonstrate itself in physical imbalances. I saw a study recently that said some 60% of cancers come from unforgiveness.
Wow.
Right? So in your mind, you feel wronged and you feel harmed, and it comes through in your body. So I think it's really important that everyone recognize. I think we're all on the same page. If you got a physical problem, diabetes, no one has a problem with you taking your insulin or taking your medicine, right?
Right.
But it seems like, especially in Black communities, if somebody has a mental illness, they're like, oh, just pray that away. Girl, you need to just, snap out of it.
Right.
Depression is real.
Right.
There are real imbalances in our bodies. There's a drug in our body, a hormone called serotonin. And if that's out of whack, you can be clinically depressed.
Right.
And if you're clinically depressed long enough, you can feel like, you know what, I just don't want to be here. And that's a real situation in our mind, and it's caused by an imbalance.
Right.
So we need to just realize that mental health is important and can be treated, and physical health is important and can be treated.
Got you. No, and I think that is a valuable point. And because, of course, within the African American community, you touched on it just now, it's kind of a taboo thing to say, I'm struggling with something or I'm dealing with something. And it stretches across a very wide pond. Yeah. So there are a lot of people who aren't looking for treatment, aren't receiving treatment because they're not willing to say, I'm having this particular struggle or I'm dealing with this. Yeah. So I think my question to you, with the healthcare piece, because for those of us, or let's say we have a loved one we think that might be struggling or something is going on, is there any way that we could inadvertently connect to those type of services where...
So, you can be direct. One of the things that's really important is that when you need help, to ask for it, right? If someone is in an emergency, we call 911. Someone is in a mental health emergency, there's another number called 988 that can connect you to counselors and crisis folks who can get you through that situation. And it's really not that well known, but getting help for another person can be something sometimes just as simple as saying, not in a crowd or anything, but it just seems like you're struggling. Do you need help? And being able to connect that person and say, there's no shame in getting therapy. There's no shame in struggling, right? If you were to fall down and break your ankle, you don't just stay down because your ankle's broken. If you are struggling mentally, don't stay down because you're, emotionally challenged. Get help, get your ankle wrapped, healed, and then you can begin to run again,
Right. So let me ask you this, because you said something, and while I'm thinking about it, you were talking about the serotonin, right? And how if the levels are off, that kind of leads to like the depression, right? That's how... And
there's other things too. I just, but just one example.
Got you. Is there any way to kind of like naturally enhance those things? Like, is there a natural way to enhance serotonin?
One thing that's really important and people don't even realize, sometimes people stay inside all the time. There's a condition called seasonal affective disorder. And people who don't get sunlight, sun is like a food. That's vitamin D, right? So if you don't get a certain amount of sunlight, you can be depressed. So, specifically serotonin levels, it's looking at why is it imbalanced, but getting enough rest, getting enough sunlight, getting enough of the proper foods. Sometimes we don't nourish our bodies, and that can be a challenge. And also just getting yourself checked out because you don't know where the imbalance is,
right? To
make sure that it's addressed appropriately. We don't have a problem going to a professional for a lot of things, but sometimes we don't trust professionals and they'll say, they're trying to get my money or whatever. But there's an expertise that God has given a whole group of people that we can get the information, just make sure that it makes sense, and then, heal ourselves, get ourselves to healing.
Yeah, I think that is powerful. So, I mean, in essence, because somebody like me, I don't go outside a lot. I'm very much a homebody. So, I mean, not saying that I'm
Just
depressed. It could
occasionally.
be, it could be. But you're right, to make sure that you take that opportunity to exercise, get outside, do something different.
Yeah.
It kind of...
It's really funny how people don't feel like exercising. But if you do it, like even a short walk outside, you have, dogs. I saw those beautiful puppies. Just take them outside, take a walk. It can give you a different attitude, and definitely an exercise that you enjoy. Like, I'm not a lover of, super aerobics or whatever, but we like to ride our bike. We like to, skate or do something that you just enjoy for your own, well-being.
Right.
So that's a good thing.
Right.
To find something that you like to do.
Nice. And I think that is a big deal, because most of us, we trying to figure that out. Because I mean, everybody seems to, especially with COVID.
That's the journey, though. Everybody's like, oh, I'm just waiting for God to give me what I'm supposed to do. God has already told you what do you love?
Right.
That comes from Him. He designed each one of us special. And so the things that excite you, that bring you joy, that you enjoy, those are from God. Do more of that. Learn more of that.
Nice.
Yeah, it's cool.
Nice. I appreciate that. Now let me just ask you this, because I know there's probably somebody out there thinking the same thing that I'm thinking, and having dealt with a miscarriage of my own, having had that experience. What advice would you give to the woman out there who doesn't necessarily know what are the best questions to ask? I should say that when you're seeking out care, or you're in the emergency room, or you're looking for help. What should you kind of put out there firsthand? What should I ask?
So when dealing with pregnancy and a lost pregnancy, I would always have a conversation with my OBGYN to see if there's any contributing factors. Some women have what they call like an incompetent cervix. So there's a need for a cerclage or some way for you to help you keep the baby. Conversations and keep asking questions is really important. A lot of people, before they get pregnant, they actually start taking vitamins and folic acid, because your body needs to kind of be optimal in order to cook a baby. So I would just say each individual woman out there has to have that conversation with a GYN doctor that they feel comfortable with, or an APN. I'm a nurse, so I'm always going to advocate for nurses, and I think they give the best care. But no offense, docs. But have that conversation, right, and find out what are the things that contributed or may have contributed to the loss, and then how do I optimize my physical state, my emotional state, my body, so that I can carry a pregnancy to term. And then you just have to see what's going on. There's so many reasons, and I don't believe God makes mistakes, right? So in situations, what are the other options? What are the ways that God wants me to mother? And every mother is not someone who had a baby come through their womb. That doesn't define it. I think that there's many, many situations, but also realize you're not alone. There are so many women that have been through infertility and challenges with pregnancy. So to network with other women, even if it's online, even if it's, in a group, you can learn from each other and strengthen each other. It says iron sharpens iron, that no one can identify with you as much as somebody who's been through what you've been through.
Right. And all of this kind of ties back into what we were talking about anyway, having your mind and your body working on both of them, and being okay with working on both of them. It's okay to get help if you're not feeling all the way mentally together, and it's okay to get help if you're not physically together.
Correct.
So I just want to tell you that I absolutely appreciate you, and thank you so much for coming and giving us this information, and we definitely will have you back.
Wonderful. I'm ready. I'm ready. I love it.
It's gonna be awesome. And I know that there's somebody out there, just in case if you missed it, Dr. Greene gave us some very good information today. If you are in need of any type of assistance, the number that she referenced was 988. That's for mental health assistance.
Correct.
If you need help with something mentally, 988. So I want to tell you all, thank you so much for coming and joining us for this episode. Thank you, Dr. Greene, for helping us and giving us all of that good information. And for those of you out there, I cannot wait for you to come back. Let me know if you liked this episode. Like, comment, subscribe, click the bell so you can get notified. All of the above. We look forward to seeing and working with you once again. Have a good one, y'all.